Yes, sir. I have a concern, and I believe our viewers at home also will have the same concern. With regards to um, people that have or that are battling with diseases that are terminal. For
Okay.
instance, HIV, tuberculosis, and they just believe that they have been healed, like according to what faith means, evidence of things not seen. And with that, even without medical proof, they just believe that it is done. And probably working with adrenaline, they feel like they are not feeling the symptoms anymore.
Okay.
So, what do we have to bring out from that? Like, how can you advise people out there, sir, that they should do when they believe that God has healed them, battling with such kinds of diseases, and they are not feeling it anymore? Actually, they are not having the symptoms anymore. So, what do you have to say concerning that, sir?
Just like we said, faith is the substance of things hoped for, the evidence of things that are not seen. That definition is very deep.
Mm.
But as deep as it is, we can also, it's complete. So we cannot deny ourselves and we cannot deceive ourselves.
Okay.
I have seen a lot of cases. Some of them have been good, some have been really bad, and the bad ones have been terribly bad. So when there's a terminal illness, in the case of terminal illness as we're talking about, we need people to understand that you believe,
Okay.
but if your faith is not enough to carry you absolutely without any treatment, you probably will need to also accept a form of treatment with your faith.
Okay.
I hope you understand what I'm talking about.
It has to be both.
Yes.
Okay.
Because sometimes, yes, we believe. I know a particular lady, sad story, young lady, less than 40 years old. But she had believed that she's fine.
Mm.
But she had lump in her breast and she believed that that lump is going to go away. It's not going to go, it's not going to travel away. You see, when you believe,
Okay.
and you pray, and that prayer is heard and is answered, you will not see the lump again. Not that the lump is still there and you are still believing.
Believe it is not there.
That's denial, living in denial.
Okay.
Do you understand what I'm saying now?
Yeah.
That is living in denial. That is all. You can't wish it away. When you pray, it goes away, it has gone. You will not see it again. And it's a different thing to say that there is a lump. A doctor made the diagnosis of a lump.
Okay.
It was a doctor that made the diagnosis. Okay. This is important for our young ladies. And you went to pray, somebody prayed, and they said the lump has gone. It's only supposed to confirm that the lump has gone.
The person that saw it.
It's the doctor that should confirm. But what we find is that people just believe it has gone and they leave it there. And they say it has gone. You have not gone to confirm. See, if you look at testimony, especially the one that people share, on turning points and all that, you see that they will tell you, look, they went for MRI, they went for CT scan. These were the things that is evidence-based.
Okay.
And then look, they prayed, they had this, they had that, and then they believe it has gone. And then it went back to, sometimes they will not even know it has gone. They just went back to see the doctor and believe that it has gone. And they did the same test all over again and found no trace of what was there before.
Okay, so
that is the evidence.
You mean that we have to get a physical evidence for whatever we believe? Like, you have
I don't want to say physical evidence as though you must look for the physical.
Okay.
I'm saying that we need the evidence that it has gone. Because you can have faith and believe.
Okay.
And you know that this is still there. Okay, somebody has there's a particular another story now. Somebody had a lady, you're a very young lady, 20, 22 or so, early 20s, and had this breast lump, but was keeping it. Very painful though, and eventually it became cancerous. So this lady already had cancer. Now, they were still believing, and this cancer spread to the chest. So she had metastasis to the chest. In the process of still believing, they started treatment. At some point, they stopped the treatment, believing that healing has taken place. And then the metastasis went on to the legs, to the femur.
Wow.
And so it went to where we call the neck of the femur. So the lady can't walk properly again now. Now, I believe with them that God, I'm still believing that God is going to heal that lady. I'm still, as a Christian, I believe.
Okay.
But I also know by my medical information that this lady should be taking treatment and should not go away from, because while she was taking treatment, the thing was going on at a very fast rate. The system was responding. This lady was almost back to normal. Everything was getting clean, but they now stopped. Do you understand what I'm talking about?
Yes, sir.
So we should be wise in what we are doing.
Okay.
So now, sometimes the physical evidence is still there and we believe. I understand, but it's terminal. So don't let us say because we believe, we take no step, we're just quiet. At the end of the day, what happens, it could go beyond what we could ever imagine.
All right.
You understand what I'm saying?
Yes, thank you. Sir, having balanced for us that both are important. Medical intervention together with our faith. I have a concern regards which one should come first. You know, you've talked about all these strong diseases, the cancers, we talked about HIV and some other things. In the instance of what we call light disease, like for instance, I'm having a headache now, what should be my first step? Should I pray about it or I should seek medical intervention first? Which one should come first?
That's a very, very good question that I was even hoping I was going to use that my concluding statement. But before I answer that question,
okay,
I wanted to add more to the earlier question you asked. Okay, so I have this particular example of somebody who had hepatitis.
Okay.
You understand? And it was confirmed hepatitis, did several tests, was confirmed. But apparently he just got it along the line. So he started treatment.
Okay.
And he was taking all the treatment. He treated for over a year and was believing God.
Yeah.
He was just believing God and praying. He came to me, I encouraged him. But he was taking treatment. He was taking his drug. I have not seen somebody as religious as that. But the young man will come to me and say, doctor, are you sure? I say, I'm not saying anything. I'm just saying God can do anything. Yeah. So one day, I just told him, so he went for, I think he had to do something. I just said, okay, come and do your test again. He repeated the test. It was negative, hepatitis negative. I said, excuse me. I went to the lab, I said, you people are wrong.
Check it again.
Check it again. They took that sample and repeated the test again. It was still negative. I said, no. Oh yeah. I called this man, I said, come back. Come and take the sample in my presence like this. They took it again, negative.
Wow.
I said, okay.
Now we can be sure.
Now God has done it. I don't know if you understand what I'm talking about. So, see, this was something that even the wife was aware. She did the test, she went elsewhere, she went to so many other places. It was positive. All his friends, they were aware that it's positive. They were even making jest of him. Because when his friends went to take the vaccine, that was how he detected that he was positive. Because all his friends took vaccine and he couldn't take the vaccine. And he went elsewhere. He said, they said I have hope. I said, sorry. Do you understand? But yes, today now is negative. He's done it several times. He's done the viral load undetected. So God can do anything. For that, I think it was God that did. I'm confident. I'm sure it's God that did it. So there are instances like that where things happen and you know. But this person I just told you now didn't sit back.
Yeah.
Yes. Exactly. There's another person also that has HIV. And I told this person, keep taking your drug, but keep praying. God will do it.
Okay.
Do you understand? Now, the person has stopped coming, so I don't even know what's the status. Okay. But if God decides to heal, I will also be happy for her. I just believe God can do it. Yeah. So now, back to your question.
Yes, sir.
So what comes first? Now, there's something I used to say when it comes to issues like this. I normally say that the nature of the response that we give to situations around us, whether medical or challenge or emotional or physical or family, is a reflection of the depth of our experience and encounter with God. There's no two ways about it. It is the encounter, the level of encounters that we've had with God that will determine the nature of the response that we'll give to challenging situation, whether it is health or it is financial or it. So when we have financial challenge, for instance, what is the first thing that comes to mind? How am I going to get this money? Who's going to loan me this money? Where will I get loan? Okay.
Yeah.
Can I go to a bank? So if that is our mindset, then you can be sure that we are not even thinking of God giving us a miraculous provision.
Yeah.
Do you get it now? Yes. And it dovetails into every other aspect. I have been on the road before, I didn't have money, and I just trusted God that I will see a lift. And somebody came and carried me.
Miraculously.
I don't know. It happened. You know, sometimes in those days when we are young, we just want to put God to test. God can do it. And he did it by faith. You understand? So now, if somebody is now that kind of a person who is primarily preoccupied with finding solution by himself without letting God, without bringing God first, when there's headache too, you say, hello, Pastor Mom, oh yeah, give me this, give me that. First and foremost. It is when the thing refuses to go, we start thinking, this headache is not going on. And then we start thinking also, malaria, let's get anti-malaria quick. Okay. So if our mindset is such that God, please take care of this. God, take care of this. I don't use drug normally. I don't use drug. Only recently when I began to realize that okay, there are some supplements I need to be using. So I started using supplements once in a while. But a few days ago I had headache and I checked, there was no reason for me to have that headache. Not even that I was stressed, no. Okay. But the headache kept coming and it was giving me some concern. I just prayed. I said, God, please take care of this headache. When I woke up this morning now, I didn't find any headache again. Wow. So if our mind is God first, then we will be able to experience God more. Okay. You know, but if our mindset is, let us take this, then our faith will keep on building in medication, in drugs, in all that. And that's what as Christians we need to watch against.
Sorry, sir. What if you haven't prayed concerning that your headache?
Yes.
And you wake up this morning, or it persists for days?
And it's still persistent.
So what point will you say that, okay, at this level now, I need to take my drug?
Okay, so if after, so that's a balanced question. Now, if after you have prayed, and you realize that it is not responding, that is the condition is still there, the next thing to do now is to ask God for the next direction. Okay. You know, and that's the point. That's the meeting point, the dividing line that we often skip. You see, because sometimes, if for instance somebody is having a financial challenge, and we're discussing something recently, and I said, if you are in a financial challenge and you have prayed for divine provision and you did not get, and it did not come, or it didn't come at that time, and maybe God has another way, and what is coming to your mind is to get a loan. The Bible is not against loan. It's not. The Bible is not against it. Jesus even said, those of you that are giving loan at high, so in their culture at that time, it was normal. However, as a child of God, you also need God to guide you and direct you as to who to even meet for such kind of help. We must be able to learn to trust God and ask Him at every moment. The same thing in our health. Sometimes I tell people, you even need to know which hospital to go. Let God guide you. You are pregnant, let God guide you on the hospital to go. Let God guide you on the kind of doctor. Everything at every stage, we pray about it and trust God to give us that guidance. Because that's when we can come up with testimonies that will glorify God and say, in fact, God just gave us everything. If you see the way it went, by the time we got there, it was like they have been waiting for us. Everything. The doctor just worked. In fact, the doctor is a child of God. You know, everything will just work out. You understand? So we need to learn to always struggle. So you wake up, you are praying, it's not going. God, what should I do? And God will guide. That's one thing. He will not be silent for His own. He will guide you. Okay, do this, do that, or rest, or do this, and that guidance will lead us to the perfect solution.
Yeah, it's been a good time with you, sir. Thank you very much.
Thank you.
So what are your parting words for our viewers concerning this, sir?
Okay, yeah, for everyone at home, I'm going to say that we should take our health seriously. that our health is important, and we should be stewards of our body. Yes, we should ensure that we will take good care of our body, do regular health checks as at when due, because no matter what vision we have, if the body is not able to carry it, it will be very disappointing.
Yeah.
So we must ensure that we take good care. That's our responsibility. Take good care of our health and ensure that we do regular health checks. Don't run away from health checks, because it will give you an early sign. There are so many things. The prevention, they say, is better than cure. There are so many things we can prevent, and you don't even need, it's just for you to know and have an information. You know, I like using other examples because now everybody here now, and anybody listening to me, you want to know what's your balance in your bank account.
Yes, sir.
Exactly. So it's the same thing. You should know your head balance. You know your numbers. You should know that your numbers are correct. You call it numbers. In most advanced world, they call it numbers. You should know your numbers. You should know your BP. These are things that have to do with number. The upper one, the lower one, the pulse. You should know your cholesterol numbers. You know, you should know your, these are you should know your weight and your height. These are things you must be able to supply at the tip of the finger. So, and that will help you to know that, okay, there's need for you to make any adjustment. Some people even know the number of the calorie that they need to burn. And they go on. That's why you see them in the more Western world. They wake up every morning, they want to exercise, because they know they want to live long. And so for that reason, they do that. And that doesn't reduce their faith. You understand? It's just a responsibility of our body and ensuring that we eat well, balanced diet, healthy living, resulting in healthy life for us to carry the vision of God to a ripe old age, and God will be glorified.
Amen. Thank you very much, sir. We are grateful, and we hope to see you some other time.
Thank you very much.
Thank you, sir. Thanks to our viewers. God bless you.